Igama lami ngu-Princess Khumalo. I'm from Musasa project Bulawayo khonapha. I'll just give a brief introduction of what Musasa is and what we do. Musasa is a non-governmental organization, and we work with women and girls who are survivors of gender-based violence. So mostly we provide what we call direct services, and these include psychosocial support, legal support. There is also temporary safe shelter, as well as cash assistance for the survivors to access other services which are not available at Musasa. So we are present in all the provinces in Zimbabwe, and we have shelters across the country. We have a shelter in Bulawayo, we have a shelter in Umzingwane district as well. I'll talk about Umzingwane district mostly. We also have a shelter this side in Ndebele land, North Ebubi district, Nyathi Laphan. So as we provide our services, we come across a number of issues. Maybe let me, for the sake of time, I'll just go through a few of them. Let me start by talking of gender justice. When we talk of gender justice, we are referring to issues to do with the equity and equality in terms of distribution of resources, the ones that we have as a nation, as a country, as a society, as a community. So once we lack gender justice, it means there will be gender inequality, there will be power imbalances here and there, and GBV like because of that. Why? Because GBV at times is caused by those power imbalances, the patriarchy that we have as a society. Causes gender justice, gender injustice, manengi, but I'll just go through a few of them where we can talk of a patriarchy. Our societal mindset can cause gender-based gender injustice, inadequate legal protection of the vulnerable groups, lack of bodily autonomy, especially amongst women, restrictive religious freedom on women can lead to gender injustice. So when we talk about gender-based violence, I'll give you a definition which is from the UN General Assembly Declaration on the Elimination of Violence Against Women. That's from 1993. They describe gender-based violence as any act that results in or likely to result in physical, sexual, or psychological harm or suffering to women because of being women and to men because of being men. This includes threats of such acts, coercion, or arbitrary deprivation of liberty, whether occurring in public or in private life. That is the definition of gender-based violence from the UN. Ama-causes achiyana ngendawo nge-society, but what we have come across, I can summarize to say most of the causes are emanating from patriarchal issues, disrespect for the other gender, there is abuse of power. We also have harmful practices which can be religious or cultural. etc. There are many other causes, but I'll say these are the main ones, and I'm basing these on the cases that we have handled as Musasa. These are the main causes that they bring up forth. We cannot deny that gender-based violence often affects women and girls more than men. I'm not saying men are not experiencing GBV, they are, but the statistics are higher of women than of men experiencing GBV, and GBV can be in the form of physical abuse, sexual abuse, it could be economic abuse, it could be psychological abuse, just as defined by the UN. So these abuses can lead to injuries, they can lead to death. Of late, we are having quite a number of murder cases going on because of intimate partner violence. So that's where you can see ukuthi JPV can end up leading to death of the victim or even of the perpetrator himself, because at times the woman will be trying to defend herself or just trying to retaliate, and kugcine sokusiba ngokunye, death then happens. At times you see even women resorting to killing the kids as well. We have had cases of women who choose to poison the kids and then kill herself after that, or the men doing that. So GBV can end tragically in death. It can lead to divorce, it can lead to imprisonment, it can lead to the children becoming orphans, just bengasela muntu obagcinayo because uparent sebhubhile, and also bakwanisa ukugcina bengela muntu obagcinayo because the parent omunye sebhubhile, omunye is now ejele. So abantwana bagcina bedubeka kakhulu because of gender-based violence. So emzingwane, our shelter was open to public for assisting GBV survivors from July 2020, that is last year. So from July up to the end of April, we have managed to assist about 396 survivors of gender-based violence. These are unique individuals without counting them twice. So these ones have accessed GPV services at our shelter. Out of the 396, 219 have accessed shelter services, while the other number is of clients who walk in to access services, but they don't really need shelter, so they go back to their homes. While others, we reach them out when we have our community outreach activities. They access mobile counseling while we are doing dialogues in the community. We also have 71 accompanying children who have come to the shelter to access services as they come together with the woman. Sometimes when the woman experiences gender-based violence, uyabe labantwana endlini and uyakwanisa ukuthiwa phuma lapha hamba labantwana bakho. There's no way we will turn away the children and shelter the woman. So we are going to, we shelter the woman and the children as well. Whatever services they need to access while at the shelter, we are going to provide. Even if the child gets sick, we will assist. Singakhangela ukuthi ayisuye oyi direct survivor ye gender-based violence. So out of the 396 cases, 25 have returned for more services after experiencing recurring GPV with their intimate partners at home. Out of the 396 survivors, 29 were teenagers who had fallen pregnant. So the previous speaker was talking of sexual and reproductive health and the rights which come with that. And I was thinking of these 29 young ladies to say, most of them fell pregnant. It was not rape for all of them, though with others it was rape, but for some it wasn't rape. They had consented to sex, but did they have the education that will help them prevent pregnancies? Were they ready to be pregnant? Are they aware of the rights that they have in terms of reproductive health? Yeah. So it's another issue that we need to look at as stakeholders to say, youth yetu, are we giving them enough information on sexual and reproductive health? Are we friendly enough for them in our health facilities such that they can come and freely access family planning methods or family planning education without us judging them ukuthi sibe sesibathi usemacansini ungaka, why are you doing that, kudala sasingenzi so and so on and so on. There are also issues of women with disabilities who are differently abled. Uyafika clinic and you find unesi, we had a case where the survivor was saying unesi wathi kimi izilima la ndithanda izinto zohlaba idepo yani. And you are like, nxa umuntu elokulima, does it mean kala ma sexual feelings yini? What are we saying to those people? So is our health system friendly enough for the youth and the persons with the persons who are differently abled as well? I was a bit worried about the teenage pregnancy issue. It's not only in Mzingwane. It's quite widespread in most of the rural areas, even in the urban areas as well. But yukutangila ma statistics lapha, you find ukuthi the cases that we handle mostly of teenage pregnancies are of girls who are coming from the rural areas. So are we giving enough support to those girls in the rural areas, or we are providing information to bonaba abase town eduzane lathi, or is it because the technology ifinyelela bonaba abase town more than abase makhaya? I don't know. Also, we managed to assist 35 survivors who had experienced rape, and only 5 of them had reported within 72 hours and accessed PEP. Laba banye mawubabuza ukuthi why lingaphangisanga ukureporta, they'll give you reasons, maybe to say abazali bathi bafuna ukuthi bekhulumisane lo perpetrator bembhadalisa damage and so on, or maybe yena umntwana wayesesaba ukukhuluma kwaze kwaphutsha later on when she's pregnant or when she has an STI on her. So you find ukuthi we also have burden yokuthi as stakeholders, when we go out there to disseminate information, let's also include these young people, let's include the community, let's talk to them and try ukubancedisa bayibona ukuthi okwabo damage and so on lingakwenza, but are you helping the child? Are you doing any justice at all? Or maybe vele umntwana lo sesimfaka futhi kolunye uhlupho, ngoba as a society we talk much about women empowerment, but imagine a girl child lo maybe ule 14 years, because most of them are between 10 to 16, 17 years old. Usezithwele se lo mntwana selibhadalisa damage, but esikolo she's no longer going, and then what? And we talk much about women empowerment. How are we empowering her as a esehlezi ugelwana? We want to think about such things even as we talk about gender justice here, to indaba ze-equality, distribution of resources as well. So nxa sikhuluma ngama sexual and reproductive rights, I'm not going to define ngoba uDoc defined it earlier on ku presentation yakhe. Uyathola ukuthi kule ndaba zona lezi ze access to birth control, are we ready to allow our children ukuthi ba access birth control? Whether we allow them or not, they are engaging in sexual activities. As young as 9 years old, uzabe sekutshela ukuthi mina vele fine I was raped, but vele ngilo boyfriend wami uJohn and so on and so on. We have handled a case of a 12-year-old who was pregnant. Ekutshela ukuthi ngiyamthanda uchomi wami and she's 12. You are wondering ukuthi wazini ngothando. So I don't know what we are saying as a society. Lami as a mother at times, I ask myself, what are we supposed to do? Like uDoc said, at times when we talk about sex, abanye bacwila phansi kwamatafula and so on. But if we don't talk about sex labantwa bethu, someone else out there is going to talk about that sex, and you don't know what they are telling your child. And after that, uzafuna uku-experiment, and what then happens after that? They are also exposing themselves to sexual exploitation. Ngoba kabala information egcweleyo about sex. So what are we saying? What are we doing as stakeholders as well? even in terms of policy making, are we including them kuma issues that touch them as the young people, or we are just saying siyaba include but kungacaci ukuthi siyaba include? If we are including them, what are they saying? What we wish for them, is it what is in their best interests yini? Kumbe thina sifuna ukufaka kuma policies things which are our interests thina, ngoba sizaqeda isikhathi sihlela ama policies and so on. If we don't involve them, the young people, sizahlela okungayisikho. Let's include them. Let's involve them. Even the women as well, issues to do with maternal health, let's involve them. Even the men as well, let's involve them. When we talk of maternal health issues, abanye, they fail to access ama maternal health services, not because the clinic ikachana, kumbe not because the clinic kuloma mpinka kula nurse, but because the religious belief yakhe imtshela ukuthi thina siyakhuleka siyafasta, akuyiwe esibhedlela nxa ubelethela khonapha kulo mamu. I can't remember the name that they use, is some Shona word, but we have those women who fail to access maternal health care because of religious beliefs and other cultural beliefs. As I finish my presentation, I would say we do provide cash assistance for women and girls who want to access or who need to access maternal health care. We provide them imali ukuthi bebhalisa esibhedlela when they need to. Even kungathwa njengabogeli bona abama 12 years 13 years, usually nxa bebeletha ngama operation, we buy those angikwazi ukuthi thwa kuyini okwesibhedlela. I'm not a medical you will help me there. We buy all those items ezifunakalayo for the Caesar to take place. So lingahlali labo nkhaya lithi ngoba kula mali we are going to sizabona uNkulunkulu uzancedisa uyangenela, come, will assist you, it's for free, will take care of the bill lona lelo eliyabe likhona. So in brief, I will say this is what Musasa does, and this is what I had for you on GBV, as well as sexual and reproductive health. Thank you.